Welcome, curious minds, to another deep dive.
Glad to be here.
Today, we're tackling a topic that might seem incredibly niche at first glance, rectal prolapse in pigs.
Right.
But trust me, this isn't just about pig anatomy. It's actually a fascinating example of how complex systems, biological systems, really are.
Absolutely.
Our mission today, to cut through the noise, look at the multiple, sometimes surprising factors at play, and really get why this seemingly simple physical issue is a huge signal for broader health and management stuff in swine production.
Yeah, exactly. It sounds specific, but rectal prolapse is a clinically significant, uh, pretty frequently seen problem worldwide.
Right.
It hits animal welfare hard, and it has real economic impacts for the industry. It's genuinely like a sentinel event.
A sentinel event, I like that. A warning sign.
Precisely. A powerful signal for a farm's overall health, welfare, productivity. And what's really fascinating, I think, is how all these different threads, genetics, diet, the environment, they all weave together to cause this one condition.
Okay, let's unpack that. What exactly is rectal prolapse, like fundamentally?
Simply put, part of the rectum pushes out through the anus.
Okay.
And it varies. It can be a minor thing, almost like a small pucker, just the lining.
hmm
Or it can be this large cylindrical mass of tissue, pretty substantial, often swollen, red, inflamed.
And who gets it? Is it specific ages?
It can happen at any age, really, but it's most common in growing and finishing pigs.
The ones getting ready for market?
Yeah, typically between, say, 8 and 20 weeks old. It seems to peak around 14 to 16 weeks.
Okay.
And it's also pretty common in sows right around the time they give birth, paraparturient sows.
Gotcha. So it sounds uncomfortable, obviously, but what are the real consequences for the pig?
Oh, it's far more than just discomfort. It's inherently painful, causes significant distress.
I bet.
And once that tissue is outside, it's incredibly fragile, highly susceptible to, well, serious complications.
Like what?
Drying out, desiccation, secondary infection setting in, necrosis where the tissue dies if the blood supply gets cut off.
Oh, wow.
And maybe one of the worst things, frankly, is cannibalism.
By other pigs?
Yes, by Penides.
Mm.
It happens. And that can lead to severe bleeding, peritonitis, often death.
That's grim.
It is. And even if the pig survives all that, a very common long-term issue is rectal stricture.
Stricture, like scarring.
Exactly. Scar tissue forms and basically blocks the rectal opening. So the pig can't defecate properly, its abdomen swells up. They call it a blown-up pig.
And what happens then?
Ultimately, it means euthanasia. There's no fixing that, really.
So connecting all that, the broader picture, the economic hit must be huge.
Substantial is the word. You've got the direct cost, more deaths, pigs culled early, treatment costs, poor growth in the ones that survive.
Right.
But then there are these big indirect costs, the labor needed to manage cases, the chance of a whole carcass being condemned at the slaughterhouse.
So it really limits production.
It's a major production limiting disease, yeah. And those economic losses you can easily count. They're often just the visible bit, the tip of the iceberg.
Suggesting deeper problems underneath.
Exactly. Deeper systemic issues within the whole production system.
Okay, so if it's not just one thing, what are the causes? You mentioned a complex interplay.
Right. It's rarely a single cause. It's more like a culmination, a mix of factors that either crank up the pressure inside the abdomen or weaken the pelvic support structures, or sometimes both.
Increased pressure, weakened support. Makes sense.
The core mechanism is pretty simple, physiologically speaking. Pressure inside the abdomen just gets higher than what the muscles and ligaments of the pelvic outlet can hold back.
So it pushes out.
It pushes out. You can think of it like a prolapse cascade.
Cascade.
Yeah, where you have an animal that might be chronically susceptible for some reason.
Okay.
And then some acute trigger comes along and just pushes it over its physiological limit. Boom, prolapse.
Okay, this is where it gets really interesting then. Those triggers. What are some of them? Let's start with, say, environment and management.
Okay, good place to start. Take low temperatures, for instance.
Uh-huh.
Cold weather.
How does cold cause a prolapse?
Well, pigs get cold, right? So they huddle. They pile up on top of each other for warmth.
Ah, I see where this is going.
The pigs at the bottom of the pile. They experience immense physical pressure on their abdomens. It dramatically increases that intra-abdominal pressure.
And the data backs this up.
Consistently, epidemiological studies show a higher incidence in colder months. It's a clear link.
Wow. Okay, what else in their environment? Slippery floors.
That too. Wet or slippery floors make them strain more, use more muscle effort just to stand or move. High stocking density is another one.
Too many pigs in one place.
Yeah, leads to pigs constantly lying on each other, stepping on each other, direct pressure again.
Even the equipment, like crates.
Absolutely. Some farrowing crate designs, especially older ones with parallel rear gates, can inadvertently put direct, constant pressure on the sow's anus.
Huh. Never thought of that.
And don't forget stress. Transport stress, handling stress. It makes them fearful, they pile up more. Again, increasing that abdominal pressure can definitely trigger an event.
Okay, so external factors, physical pressure. What about what they eat? Nutrition must play a role.
Oh, a pivotal role.
Yeah.
Often surprising, too. Especially fiber.
Too little fiber, constipation.
Exactly. Diets too low in fiber, especially for pregnant sows, lead to constipation.
Yeah.
Then they strain excessively to defecate. That's called tenesmus.
Tenesmus. Got it.
But here's the complexity. It's not always about too little fiber. For very young pigs, just weaned, too much fiber could potentially cause issues.
Yeah.
It really highlights how delicate gut health is.
So fiber balance is key. What else nutritionally?
High-density diets, the ones packed with energy, starch, lysine, designed for super fast growth.
Right, common in commercial settings.
They've been linked to more prolapses in pigs around that 30 to 60 kilo range.
Why?
The thinking is it might be due to just heavy gut fill, lots of material in there, and maybe abnormal fermentation happening in the gut.
Fermentation leading to gas.
Pressure, possibly. Even how finely the feed is ground can matter. If it's ground too fine, say below 750 microns for sow feed, it can actually change the gut microbiome, favoring bacteria that produce more gas, and again, increasing that internal pressure.
Fascinating. Are there like hidden dangers in the feed too? Things you can't see?
Yes,
Yeah.
absolutely. And this is where it gets, well, kind of alarming, mycotoxins.
Mold toxins.
Exactly. Specifically, zearalenone. It's produced by common fusarium molds that grow on grains.
And what does zearalenone do?
It's a potent non-steroidal estrogen. It mimics estrogen in the pig's body.
So
when pigs eat contaminated feed, even at really low levels, like 1 part per million, which is tiny,
yeah.
it causes hyperestrogenism. This leads to swelling, irritation of the vulva, the vagina, and importantly, the rectal tissues. That irritation makes them strain.
Wow, so a microscopic toxin can directly lead to straining and prolapse.
It's a major predisposer. It systematically weakens the animal. Think about it affecting a whole herd that's eating the same feed.
That's insidious. Are there other estrogen-like things?
Yeah, natural phytoestrogens found in some feed ingredients like alfalfa or soybeans can sometimes have similar milder effects.
Okay. And water. Does that matter?
Hugely.
Yeah.
Not getting enough water leads directly to dehydration, constipation, straining. Simple as that.
Water quality too.
Yep. High levels of sulfates, for example, can cause diarrhea, which also involves straining. And some studies have linked untreated water sources to higher prolapse rates. Could be bacteria, could be mineral imbalances.
Any other nutritional links?
Yep.
Vitamins, minerals?
There's some emerging research looking at micronutrients, things like low calcium, or deficiencies in vitamin E or D. The idea is these might potentially weaken those pelvic support structures over time. Still needs more research, but it's plausible.
Okay, so we've got environment, nutrition. What about the pig's own health, like diseases?
Critically important. Think about respiratory diseases first.
Like pneumonia.
Yeah, anything that causes severe chronic coughing or sudden violent fits of coughing, paroxysmal coughing, like you see with APP, actinobacillus pleuropneumonia, or sometimes swine flu.
How does coughing cause prolapse?
Every cough is a sharp, sudden spike in intra-abdominal pressure, repeatedly, violently. It's like pushing hard from the inside, over and over.
Makes sense. What about gut diseases? Diarrhea?
Severe enteric diseases, definitely. Things like salmonella or swine dysentery, Praxitera. They cause massive inflammation in the gut, severe diarrhea, and that intense straining tenesmus again.
So coughing pushes, diarrhea pushes.
Pretty much. And then there's the cell's physiological state around birth.
Right. You mentioned periparturient sows.
That's a super high-risk period. There's the physical straining of giving birth, obviously, but also huge hormonal changes, especially the hormone relaxin. Its job is to relax pelvic ligaments for birth.
But it might relax things too much.
It causes a generalized relaxation of all pelvic tissues, potentially making prolapse easier. And older sows, ones that have had many litters, they're at greater risk too. Just cumulative loss of tissue tone over time.
Okay. One last area then. Inherent factors. Anatomy, genetics.
Definitely relevant. Tail docking, for instance.
How does docking tails relate?
Well, if the tail is docked too short, there's clinical evidence linking it to increased prolapse risk.
Really? Why?
The theory, backed by some research on nerve changes, is possible iatrogenic damage. Accidental damage during docking to nerves that supply the anal sphincter weakens its control.
Wow. So how short is too short?
The common recommendation now is to leave at least a third of the original tail length. Avoid docking right up against the body.
Good tip. And genetics. Is it inherited?
Strong evidence for a genetic component, yes. Heritability estimates for pelvic organ prolapse can be quite high, up to 0.35 in some studies.
Which means you can breed for resistance.
Exactly. It suggests selection against it is feasible. Genomic studies are even finding specific chromosome regions linked to risk.
Pointing to specific genes?
Potentially, yeah. Genes involved in things like estrogen receptors, collagen synthesis, which affects tissue strength, and calcium regulation.
Are there other individual factors, like size or sex?
Yes, interestingly, low birth weight pigs seem to have a significantly higher risk, over 3 times higher in some data.
Huh. And gender?
Male pigs also appear to be at higher risk than females, maybe around 2.3 times higher. The reasons aren't totally clear. It could be anatomical differences, maybe hormonal.
It's so complex. You see why some studies might get conflicting results, right?
Yeah.
Like one farm finds a link to coughing, another doesn't.
Absolutely. It underscores the sheer complexity of these multifactorial diseases. You really need boots-on-the-ground investigation on each farm to figure out the specific local triggers. What's dominant in one herd might be minor in another.
So, okay, putting it all together. A pig develops a prolapse. You said it's an emergency. What's the immediate action?
First thing, got to get that pig separated from its pen mates.
Okay.
Immediately.
To prevent the cannibalism.
Exactly. That's priority number 1.
Yeah.
Then you quickly assess the prolapse tissue. Is it still viable, pink and moist, or is it dark, dry, clearly dying, or dead necrotic?
And that assessment drives the next step, because I imagine the economics come into play hard here.
They really do. It's often a tough calculation, balancing welfare and cost. For a high-value animal, like a breeding sow you want to keep, you might go for aggressive surgical repair. It's complex, but potentially worth it.
But for a regular market hog?
For a market hog, especially if it's getting close to slaughter weight, the cost of surgery or intensive care might just be more than the pig is worth.
So what happens then, typically?
In commercial settings, honestly, the most common outcomes are either immediate, humane slaughter if possible, or if the damage is severe or necrotic, humane euthanasia.
Okay. But let's say the tissue is viable. Pink and
Yeah.
fresh. What can be done? You mentioned manual reduction.
Right. If it's fresh and looks okay, manual reduction is off for the first try.
How does that work? Just push it back in.
Gently. First, clean the tissue carefully. Then you need to reduce the swelling.
Ow.
Applying something hypertonic helps. Granulated sugar, even salt. It draws fluid out by osmosis, shrinks the tissue a bit.
Like a science experiment.
Kind of. Once it's less swollen, you carefully, gently push it back into place. For bigger pigs, sows especially, giving caudal epidural anesthesia first is really helpful. Stops them straining against you.
Okay, it's back in. How do you keep it there?
Usually with a purse string suture, basically a stitch placed in the skin around the anus, tightened like the drawstring on a purse.
But not too tight, I guess.
Exactly. That's the crucial part. It has to be tight enough to prevent the rectum from popping back out, but absolutely loose enough for the pig to defecate.
What's the guide for looseness?
Rule of thumb is about a 1-finger opening for a growing pig, maybe 2 fingers for a full-grown sow. Too tight, and you cause your own problem, a blockage.
Right. Okay, what if the tissue isn't viable? It's damaged, dark. Reduction isn't an option.
Then amputation is necessary, cutting off the damaged part.
Is that common? Sounds tricky.
Surgical amputation is an option, but yeah, it's technically demanding, it's costly, and honestly, it carries a pretty high risk of causing a rectal stricture later on.
The scarring problem again.
The scarring problem. So a more practical method, pretty popular on farms, is non-invasive amputation using a prolapse ring or tube.
How does that work?
You insert a hollow plastic tube or ring into the center of the prolapse. Then you put a tight ligature, often an elastrator ring, like they use for castration, around the base of the prolapse, compressing the tissue against the tube.
And then?
The ligature cuts off blood supply. The tissue outside the ring undergoes ischemic necrosis. It dies, and the whole thing just auto-amputates, falls off, usually in 3 to 7 days.
Wow. Advantages.
Simple, cheap, doesn't need anesthesia usually.
Disadvantages.
Still carries a risk of stricture formation as it heals. It's not risk-free.
No matter what you do. Sounds like aftercare is important.
Crucial. Regardless of the method reduction or amputation, you need post-op care. Antibiotics to prevent infection, NSAIDs for pain and inflammation. And definitely provide a laxative diet, something easy to pass, to prevent constipation and straining while it heals.
And that big long-term complication you keep mentioning, the stricture, that's the main thing to watch for.
Absolutely. That rectal stricture, that ring of scar tissue, it's the most significant long-term issue. Usually shows up 2 to 4 weeks after the initial prolapse or treatment,
Leading to the blown-up pig.
leading to the blown-up pig and euthanasia, which really highlights why acting fast is so important. Treating a fresh, viable prolapse quickly and with minimal trauma gives the best chance of avoiding that whole cascade of severe inflammation, tissue death, and scarring.
It really drives home the point. Prevention is paramount.
Totally. Given the welfare issues, the economic losses, the often guarded prognosis after treatment, prevention is absolutely the cornerstone of managing this effectively.
And since it's multifactorial, prevention has to be holistic, right? System-wide.
Exactly. You can't just fix one thing. Integrated herd health management is key,
Meaning?
meaning robust biosecurity, good vaccination programs to control those respiratory diseases that cause coughing, and managing enteric diseases that cause diarrhea and straining, good gut health management overall.
Nutrition strategy.
Highly influential. Ensuring adequate, but not excessive, dietary fiber is paramount for maintaining soft stools. A rigorous mycotoxin control program is non-negotiable.
Testing feed, using binders.
Yep. Testing incoming grains, strategic use of broad-spectrum mycotoxin binders in the feed has been shown to help reduce incidence. Proper diet formulation, avoiding sudden feed changes, ensuring constant access to clean, good quality water, all critical.
And environmentally, what are the big prevention points?
Maintaining that thermoneutral environment, good ventilation, heating if needed to prevent cold stress and that dangerous huddling and piling.
Docking density.
Proper stocking densities, not overcrowding, keeping floors dry and clean. And really looking critically at sow stall and farrow and crate designs. Are they putting constant pressure on that rear end?
Thinking about those details.
And stress reduction during handling and transport. Calm handling minimizes that fear-induced piling.
Okay. What about longer-term fixes? Genetics, tail docking.
Both important. Long-term reduction can definitely be achieved through genetic selection. Since heritability is moderate to high, producers can actively select breeding lines with lower predisposition.
Makes sense.
And critically reviewing tail docking procedures, making sure tails aren't docked too short to avoid that potential nerve damage. Leaving at least that 1/3 length is a good guideline.
And maybe the most important thing overall.
Meticulous record keeping. Seriously, for every single prolapse case, note the age, diet, location in the barn, season, any other signs the pig was showing.
Why is that so crucial?
Because analyzing that data over time can reveal farm-specific trends. It points you towards your specific correctable issues. Is it happening more in winter in this particular building? On this specific diet, it reinforces that whole canary in the coal mine or sentinel event idea. The data tells the story.
What a deep dive indeed. We've really unpacked a lot here, from all those multifactorial causes, environment, nutrition, disease, genetics, to the treatment options, the outcomes, and crucially, those comprehensive prevention strategies. It's crystal clear that rectal prolapse in pigs isn't just some random, isolated event. It really is a profound indicator of that intricate balance needed for good animal health and efficient production.
Exactly right. And if you connect it back to the bigger picture, those economic losses you can directly attribute to prolapse. They really are just the tip of the iceberg.
How so?
Think about it. If you have widespread mycotoxin contamination causing prolapses, that same contamination is likely dragging down the performance and immunity of the entire herd, not just the pigs that prolapse.
So the prolapse cost is a fraction of the total hidden cost.
Precisely. Or if chronic respiratory disease is driving prolapses through coughing, that same disease is impacting overall growth rates, feed efficiency, treatment costs across the board. The visible prolapse losses hide a much larger submerged cost of those underlying systemic issues.
Which really underscores why investing in fixing those systemic problems, better ventilation, feed quality control, biosecurity, is so justifiable economically.
Highly justifiable. It pays back in ways far beyond just reducing prolapse numbers.
So, reflecting on all this, what stands out? For me, maybe it's just the sheer number of seemingly unrelated things that can contribute to this one specific condition. It's kind of mind-boggling.
For me, it's often how welfare and economics are so tightly linked here. What's bad for the pig is almost always bad for the producer's bottom line. And the ingenuity in some of the treatments, like the ring amputation, balanced against the push for prevention.
Okay, so for you, our curious listener, here's a final thought to chew on. If a condition like rectal prolapse in pigs can serve as such a powerful canary in the coal mine for a whole complex production system, what other seemingly isolated problems, maybe in your own field, your work, or just your interests, might actually be similar powerful indicators, indicators of deeper, interconnected, systemic challenges that really deserve a much more comprehensive look, something to think about.